The nation's capital came alive today with all partners joining in the work for HIV prevention to commemorate the World AIDS Day. The Correctional Service Band led the walk to raise awareness on the 2016 theme, Hands Up for HIV Prevention, Count Me In. More awareness have been raised and preventive approaches taken, but the public health manager representing the Health and HIV/AIDS Minister says there's been a rise in the HIV cases again.
Because globally, new infections among adults have stalled, but some regions, including PNG, has seen the number of new infections rise again. We cannot relax if we want to achieve the fast-track approach to end the AIDS epidemic by 2030. We must scale up the prevention efforts.
He says the best way to prevent HIV, which has proven to be successful, was to go back to the basics of promoting the use of condoms. It was revealed that PNG still has the highest prevalence of 95% of cases in the Pacific region.
PNG still has the highest incidence and prevalence rate for HIV in the Pacific region. And more than 95% of the HIV cases in the Pacific region are found here in PNG. As minister responsible, I want to see reductions on this HIV prevalence.
Also, the HIV advocate has also shared what she has noticed on the ground, that HIV prevention is dying out.
Programs in this country have died out. And this is a wake-up call. When it's day today, 2016, I'm just really sad to see that the HIV minister himself is not here. We have the health department staff here. The health department do their best, but what can they do if funds are cut? What can next staff do when they have a leadership crisis? When there's no funding? You know, we have to get legs in order. People, we are dying and people are, not getting the priorities right. What is the HIV minister doing about National AIDS Council? We need to get it up and running so prevention programs can operate. We have treatment programs running, but what about prevention?
However, partners like the Australian government are still committed in supporting the fight against HIV and AIDS.
Australia continues to work closely and will continue into the future to support Papua New Guinea and the government to build the capacity of its health system, as well as to work with the civil society partners on the ground to deliver health services. We are also pleased to cooperate in the development of a new comprehensive national HIV strategy, which will set out how PNG and its partners will respond effectively to HIV and AIDS over the coming years.
Meanwhile, the UN AIDS Director says last year PNG has joined the United Nations to eradicate HIV by 2030 and to 95% by 2020. But reports are showing that there's a rise in HIV cases in PNG. But some progress have been made in the last 20 years, and all partners are urged to work together to prevent HIV.
Currently, Papua New Guinea and nations throughout the world are working towards a future of zero. Zero new HIV infections, zero AIDS-related deaths, and zero AIDS-related discrimination. The goal is to make AIDS a thing of the past through provision of care, services, and support, and to do so in a non-discriminatory environment.
The opposition leader has also expressed disappointment over HIV response in the country.
Papua New Guinea, as a leadership in this country, I do not think we have done enough. The statistics are not good. We've had reports on the floor of Parliament of the deficiencies that are there, the inadequacies that we need to address. But the unfortunate thing is that the Parliament and the government, we have not been proactive enough, and our people, we're losing them. We talk about economic sustainability. We talk about so much resilience in the economy. But that's one thing that we forget, and that is very important. It is the sustainability of intelligence, of human capital, the human resource. We need to have our skilled human resource sustained throughout the years and continue to train them. But HIV/AIDS is wiping our people out, our learned people, our intellectual, our human capital.
But the government is looking at scaling up the access for HIV education, testing and treatment. The opposition leader also urged everyone to check their status in order to seek medical treatment.